Amatsu therapy combines the ancient Japanese principles that were taught to me by Professor Hatsumi with modern underpinning of the sciences of tensegrity, and it produces a model that is low impact, non-invasive to the body, aligns the whole body to become more bipedally or uprightly efficient, which then brings about poise and wellness into the body. One of the things that's unique about our approach in Amatsu is that it covers all of the systems in the body in one therapeutic session. So at our basic ANMA level, and ANMA means push-pull, then we're squeezing tissue and working with meridians, working with muscles, working with the nervous system, slowly just freeing off nodules and muscular indiscretions in the body from strain. As we progress into the Seitai model, we then focus much more on the ligaments, which have a different kind of torque, awareness or coordination around joints. They're more protective, and we find that we can actually influence joints and muscular problems much more from the Seitai model. And then we move into Shinden, which is looking at all the organs and the suspensory apparatus that holds those organs in place. And as organs move as we breathe, our lungs are bigger than when they're empty, our stomach fills up with food, our liver has to move just to allow the lungs to open. We open up the pericardial space for the heart to beat. We have intestines that are constantly in a mobility and a motility. And the movement of all of these organs is known as tergor. And so at the Shinden level, which is heartfelt, we're feeling down to move any restrictions in organs that can be the precursor to disease. Because we're not working with disease patterns, what we're doing is maintaining the body so that these disease patterns can be helped, or the body can be helped to overcome them. And then of course the final level is what we call Kenku, and that is using the cranial bone motion and the sacral motion and the craniosacral motion between the two to free off any problems in the peripheral nerves and the nerve distribution. And so that's working directly with the brain, the meninges of the brain, the flotation of the brain, and the craniosacral system. So that's how we move through the 4 levels. And a skilled practitioner, schooled in all of these levels, identifies problems and traces them through the pattern of the body that it's showing, that might be muscularized, it could be isolated, it could be one injury that's caused it, or repetitive strains. And then we find out about your lifestyle and the habitual patterns that create these, and we can reverse that. Or if it was from one trauma such as whiplash, which entrains the whole body, then we can slowly unwind these factors from the body and bring you back to a state of well-being.